Hello, Barbara.
Yes, I'm with you.
We appreciate it you are here, and time is for you.
Okay, thank you very much. I want to thank the organization, Continuum Me, for giving this lecture. As you have already said, I'm from the CNUC, that is an Ibero-American society for female urology, urogynecology, neurology also, and also a representative of the ICS in this meeting. And I want to thank on behalf of both societies that we can present here. So I'll begin with the first speech about how to define mixed urinary incontinence and to talk about the different subgroups that we can find. As you know, the ICS defines the mixed urinary incontinence as those patients who complain of both stress and urgency urinary incontinence. And that means that they've got both involuntary loss of urine with urgency and also with efforts or other physical activities. We know from the EPILATS study that the different type of symptoms in urinary incontinence have got also different frequencies of presentation in the patients, and especially in women. Patients with mixed incontinence can be the greatest group if you sum up patients with voiding storage with 14.8 and patients with voiding storage and post-micturition patients that are 26%. From other studies, we know also that the incidence of mixed incontinence increases with age. So, but I also thought, okay, is it really important to differentiate mixed urinary incontinence from patients who have pure stress or urge urinary incontinence? And I say yes. I show you this study studying the severity of urinary incontinence and the effect on quality of life in women. And the authors here found that women with mixed urinary incontinence symptoms had the highest report of severe urinary incontinence. Also, patients having urge symptoms with mixed or also pure tended to report more bladder from their urinary incontinence. And also that these women with severe urinary incontinence, those having mixed urinary incontinence, had the higher scores in the incontinence impact questionnaire when compared with patients with either pure stress or urge urinary incontinence. This is not only shown in this study, but also in others. You see in the study on the left side that the patients with mixed urinary incontinence have the highest impact in the incontinence impact questionnaire. And also, not only they have impact in the incontinence and in their bladder health, but also in sexual health and in mental health. In this beautiful study published some years ago, 9 years ago, we see that, and it's also based on the EPILATS study, we see that patients with mixed or patients with urge and other types of incontinence are the women seeking more frequently treatment. They also say that patients with mixed urinary incontinence usually have the worst perception of their bladder condition. They also have higher anxiety and depression scores and the lowest health-related quality of life scores. How can we divide or define these mixed urinary incontinence subgroups? If we have a look at the EU guidelines on the management of the non-neurogenic female lower urinary tract symptoms launched new this year, we see that there are some controversies in this definition. Because yes, we have a very broad definition with the ICS, but in this group of patients, we have patients with can have a balance between the stress and the urge urinary incontinence, or we can have patients with more stress urinary incontinence than urge, or on the opposite side, more urge than stress. And even we can have a patient with symptoms, but they've got a different urodynamic finding. For example, you can have a patient with stress incontinence clinically, but when you perform the urodynamic, you see uninhibited detrusor contractions and also the stress incontinence. And this woman has also to be tagged as mixed urinary incontinence. So we have many disorders that are in the same group. One of the most important things is how clinically identify these patients. And I want to show you some questionnaires and some tools that we can use for that, although we cannot every time do it very, very fixed. You have, for example, this questionnaire for the urinary incontinence diagnosis, the QUID. And with this questionnaire, you can differentiate patients with stress urinary incontinence or urge urinary incontinence. You also have other questionnaires to evaluate the bother that these symptoms occasion to the patients. And they can see, let's say, if it bothers a little bit, moderately, or greatly with the incontinence impact questionnaire that we have seen before, that is widely used in many studies, and also with the UDI-6, the urogenital distress inventory, is also widely used. And I want to show you also this questionnaire that maybe is less known, but I think it's very complete. And you not only have not only evaluate urge and stress, but other different symptoms that can be also very important for our patients and that can also impact the quality of life, as nocturia, hesitancy, nocturnal enuresis, insensible urinary incontinence. With 13 questions, you can know the predominant symptoms clinically, but also you can give for each one the impact of bother and quality of life in our patients. Another tool that is really important is the Bladder Diary. Here I show you the Bladder Diary we usually use in Spain. It was designed by a group of urologists in Madrid. And I find it quite complete because we have the time, the body volume, the rate of urgency. We also have a part where we can, the patient can state if they got leakage because of urge or stress, and if they need to change their pad or underwear, and the drinks they take. Finally, with this Bladder Diary, we have information about the frequency, the micturition volume, urgency and urgency episodes, or urinary incontinence episodes with urgency or with stress, and also information about the fluid intake of these patients and how frequently they change pads of underwear. However, we don't have specifically any information about the bother of the patients. When we have a look at the American Urological Association guidelines on stress urinary incontinence, I want to highlight that they say that we need additional evaluations when patients have urgency predominant, mixed urinary incontinence, or concomitant overactive bladder. But for this part of the speech, I want my dear friend, Dr. Stefania Musco, to talk to you and explain if we need other things or not. Thank you.